Hello, everyone. Welcome back to the podcast. I'm your host, Dr. Kuldeep Singh, board certified in internal medicine and geriatrics. Today's episode is extremely important because we are talking about diabetes myths on social media. Every day, I see patients confused, scared, or even harmed because of something they watched on YouTube, Instagram, WhatsApp, or other social media apps. Miracle cures, fear of insulin, advice to stop medicines. Some of these myths sound convincing, but they're dangerous. So today, let's do some myth busting. Doctor to listener, science to truth. So first, myth number one, diabetes can be cured permanently. This is probably the most viral myth. You'll see video claiming cure in 30 days, get rid of your diabetes within 30 days without medication. So here's the medical truth. Type 1 diabetes has no cure. Type 2 diabetes can go into remission, not a permanent cure. Type 2 diabetes is a more common form of diabetes, usually seen in adults. Control requires long-term lifestyle changes, monitoring, and medical care. So if diabetes had a guaranteed cure, doctors won't be prescribing lifelong treatment for it. Myth number two, just stop sugar and diabetes will go away. So many reasons say that. So medical truth is, diabetes is not just about sugar. It involves insulin resistance, total carbohydrate intake, genetics, physical activity, stress, and sleep. Even rice, bread, fruits, and portion size matter, not just the sugar. Myth number three, starting insulin means your diabetes is very bad. This myth causes huge fear and often delaying the treatment or not taking the treatment properly. So medical truth, insulin is a natural hormone. Your body produces insulin also from the pancreas, from the beta cells of the pancreas. Using insulin is not failure. Sometimes insulin is the safest and fastest way to protect organs. And delaying insulin can actually cause more damage. I know and had patients who had been into a diabetic shock state, what we call as diabetic ketoacidosis, and they were in the hospital. And there you have to start insulin to control your blood sugar, so bring it down to the safe level. And then that can be later on managed differently. I'll talk to you later in the podcast about it. Myth number four, once you start insulin, you can never stop it. Medical truth is that many type 2 patients use insulin temporarily. Like I said earlier, I had patients who ended up in the hospital with uncontrolled diabetes, complications of diabetes such as diabetic ketoacidosis. That's a condition where your body starts breaking down due to very high sugar. And that causes a person to be even comatose, in electrolyte imbalance, metabolic imbalance. Patient was started on insulin, was sent to me from the hospital to manage his insulin afterwards, and I was able to successfully convert his medications to oral medications and taper him off the insulin. So we do get success stories like that. With weight loss, lifestyle changes, and blood sugar control, insulin may be reduced or even stopped under medical supervision. So my advice to you is never stop insulin on your own based on these claims. Talk to your physician. Try to control your diabetes first with the medications, and then under supervision, your physician may be able to reduce or stop the insulin also. Next myth, number 5, is natural remedies can replace diabetes medications. This is very popular also. I see popular videos promoting bitter gourd, cinnamon, neem, and fenugreek. These substances can help somewhat managing your blood sugar, but they cannot completely replace your diabetes medications. Stopping medicines for natural cures is one of the leading causes of problems and complications we see in our practice. Myth number 6. Diabetes is caused only by eating sweets. So we often get this notion that patients come to me and they say, oh, I'm going to stop eating sweets since I have diabetes. Of course, you should do that, or they will say that my diabetes is caused because I was eating too many sweets. Truth is that diabetes develops due to genetics, obesity, sedentary lifestyle, hormonal imbalance, age, and stress, also with poor diet. So that is why even thin people can have diabetes. And I have seen some people eating a lot of sweets and never developing the diabetes. So it's not the only cause of diabetes, that is eating too many sweets. It contributes to it. Next, myth number 7 is, if I'm feeling fine, my diabetes is under control. So a medical truth about diabetes is diabetes is a silent disease. You may feel completely normal while damage is happening to your heart, your kidneys, your eyes, your nerves. Numbers matter more than the symptoms. So your A1C, hemoglobin A1C, what we call is, we know that it can, higher hemoglobin A1C can cause microvascular and macrovascular complications. Understand this, controlled A1C under 7 can continue to cause some of the damages inside. So that's why we often go for tighter control. So numbers matter more than the symptoms. Myth number 8, fruits are bad for diabetes. So medical truth is that fruits contain fiber, antioxidants, vitamins. So portion size and timing matters. Avoid fruit juices. So fruit juices have less nutritional value because they contain mostly sugar. That is, there's no fiber. A lot of antioxidants and vitamins have been lost due to that. So fear of eating fruits often lead to nutritional deficiency. So eat fruits in moderate amount and portions. Myth number 9. Diabetes happens only in old age. So medical truth is that today type 2 diabetes, which is the acquired type of diabetes, is common in 20s, 30s, even teenagers. Main reason is sedentary lifestyle, processed food, and stress. So early testing saves lives. So, we look at why social media myths spread fast, because you see emotional success stories and they touch your heart. They touch the emotional part, actually connects with you. They show before and after photos, doctor exposed clickbaits, partial truth mixed with false claim, and no accountability. So remember, viral doesn't mean verified. So what you should do instead, get regular blood sugar and A1C testing. Follow evidence-based treatment, preferably under supervision of a qualified physician. Use lifestyle changes along with the medicine, not instead of it. Verify health information with qualified doctors. So thank you for watching. If this episode helped you, please like, share, and subscribe. You never know, sharing this might protect someone from dangerous misinformation. And have a diabetes myth you want us to bust? Drop it in the comment or message us. Until next time, stay informed, stay healthy. Thank you.